Good morning and welcome back to the full committee meeting of Health and Human Services. Chair Rodney Willett, great to have everyone here, and we'll take the roll. Excellent, we have a quorum. Again, thank you. We had a little overtime on behavioral health, but we're moving fast and trying to get through a lot of really important bills. What I'd like to do this morning is start with the full committee, a couple actions there, some bills we had to carry over from last time, and I think we can take care of these fairly quickly, succinctly. I'm going to start with HB 267. That does have a substitute, so if someone could move the substitute, that would be great. We have a motion that's been properly seconded to move the substitute for 267. All in favor say aye. Aye. Any opposed? No. That bill, we would need to have a further look from appropriations, so I would appreciate that with reporting the substitute and being referred to appropriations. So moved. We have a motion that's been properly seconded to report with substitute and refer to appropriations, HB 267. And we'll go on the board. Yeah. Oh, let's see. There we go. And HB 267 reports a substitute and we referred to appropriations by a vote of 20-0. Thank you. And then a couple bills from Delegate Dr. Downey that we need to take another look at, but they're good to go. So I'm going to start with HB 815. No changes to that, so we just need a motion to report.
So moved.
We have a motion that's been properly seconded to report HB 815, and we'll go on the board. And HB 815 reports by a vote of 20-0. And then the one more bill from Dr. Downey. This is HB 841. This does have some amendments, so I appreciate a motion to move the amendments.
Second.
We have a motion that's been properly seconded to move the amendments for 841. All in favor say aye.
Aye.
Any opposed? Great. And then otherwise this is good to go, so we appreciate an amendment to a motion to report 841 as amended. We have a motion that's been properly seconded to report HB 841, and we'll go on the board. Everyone's voted? Yes, and by a vote of 11-8, HB 841 will report. Thank you. We had two bills that we needed some more time for to get from the Behavioral Health Committee. So we're going to bring them to the full committee now and start with HB 1370 with Delegate Mehta. Come on up. And thank you for waiting so patiently.
No problem, Mr. Chair. Yes, I have HB 1370, and I believe that there are a few line amendments.
Second.
We have a motion that's been properly seconded to move the line amendments for HB 1370. All in favor say aye.
Aye.
Any opposed? No. Those are before us.
All right, thank you, Mr. Chair. So the line amendments, just so you're aware, are to include CPR when it comes to the medical drills, as well as add mental health and substance use disorders to considerations that were not in the original draft. So this bill is a bill requiring the development of regulations for providers of developmental disability services to train their employees to respond to medical emergencies. This bill comes from a study done by the Disability Law Center of Virginia, which reviewed hundreds of unexpected deaths in the community over recent years. The study found that in fully half of the cases reported, appropriate response to the emergency was significantly delayed due to the absence of staff training on response. As I mentioned, it comes from the Disability Law Center of Virginia, and some of the examples in terms of delayed responses include things like calling a supervisor prior to calling 911, a supervisor in another location calling 911, staff leaving the house in panic, the inability to remember the address of the program when speaking with 911, inability to remain calm and therefore unable to listen to the 911 dispatcher, and the inability or refusal to answer dispatchers' questions. Emergency medical drills are crucial for reducing response times, improving team coordination, and building muscle memory, which collectively save lives during real crises. I will say that you will hear, Mr. Chair, from Delegate Siebold on 1380, which is, it has some of this, but I wanted to tell the story first of why this bill came about. Happy to answer any questions.
That's great. Thank you. I may have my own question, but it's good to Delegate Cohen to start with.
Thank you very much, Mr. Chair. Not a question, but speaking to the bill.
Please.
I just wanted to thank Delegate Maida and Delegate Siebold. I remember waking up and reading this story in the paper and all of the texts and calls that I got of what are you guys going to do about this? And so thank you for being a part of that. And I know how meaningful that is for not just everybody in this room, but everybody who trusts us to take care of the people that they love. So thank you for this, and I'm just so grateful for you bringing it.
Thanks. Delegate Griffin.
Mr. Chair, I have a question for the patron. I think this is a great idea. When I read it, it's like 2 thumbs up. But my question and my reservation is, this is going to apply to private organizations telling them how to run things? Is this extra training that's going to cost them? And are there groups opposed to it for that reason?
I think, so I have with me Colleen Miller, who is the Executive Director of the Disability Law Center of Virginia. I just wanted to make sure that she can come into this conversation, Mr. Chair, and if it's your pleasure to answer that question.
Let's go ahead and do that. Ms. Miller, come on up. Thank you.
Good morning, Mr. Chair, members of the committee. I'm Colleen Miller from the Disability Law Center of Virginia. We're the organization that you all have designated to protect and advance the rights of people with disabilities. It's in Virginia Code. You've selected us for that. And one of the tools that you've given us is access to serious incident reports. We look at about 10,000 of those reports every year, and we try to identify patterns of abuse and neglect so that we can address them on a systemic basis rather than a one-by-one basis. And this report that Delegate Mehta has referred to as a result of that analysis of hundreds of unexpected deaths that happened in the community. To the delegate's question of will these drills require extra training, we sure hope so. The training that is going on right now is costing lives. If we continue to do things just the way they've always been done, people will continue to die. So our expectation is that the regulations will, in fact, require some simulation, some actual practice drills so that these unexpected deaths can be mitigated. Thank you.
Thank you. And stay close. We have a question, I think a follow-up from Delegate Griffin.
Mr. Chair, follow-up question. So again, to my question, not is there a nonprofit that likes it, but the people doing the work and spending the money, are there going to be groups that are opposed to that because it's a larger encumbrance upon them?
Mr. Chair, in honesty, I think that those groups thought that this was going to be heard in subcommittee this morning, so I'm a little reluctant to speak on their behalf. They had told me that if they have a table, have a seat at the table when the regulations are being developed, they'll have a lot more confidence in the whole process. But I'm a little reluctant to speak on their behalf.
Thank you, Mr. Chair.
Any other questions from the committee? Ask the patron, anyone else that you have to speak in favor of the bill? I mean, we can certainly hear from everyone.
I don't believe so, Mr. Chair.
Okay. Anyone we're not aware of who would like to speak to the bill? Okay. Ask the patron. I know we're going to, next year, right after you, Delegate Siebold's 1380, and just for the benefit of the group, I know we had a little back and forth there, but what would be the preference? Is that they're similar bills, but yet different, and tell us what you would recommend for us to consider.
Sure. Mr. Chair, my hope is that you will consider these two separately. They are similar in that they both deal with medical drills. However, it's my understanding that Delegate Siebold's bill also has a sanctions piece that has a FISC. My bill does not have a FISC.
We have a question from Delegate Price.
Yes, Mr. Chair, I wanted to ask either the patron or council if both bills could exist or if there were any conflicts if both bills went through.
Mr. Chair, Delegate Price. So if we pass the bills and they have the same changes to the same language in the portion that they both touch, which I believe would be 37.2-405.3, the newly created section, as long as we pass the same language in both bills, they can coexist. If there's any differences, that would have to be reconciled before both bills could be effective as law.
Mr. Chair,
Yes,
may I? Mr. Chair and Delegate Price, my understanding is that, and I'm assuming Delegate Siebold can correct me if I'm wrong, the language on the specifics of medical drills, the one that's, part of my HB 1370, are identical or near identical, if that helps, Delegate Price.
Let's get this going. Thank you. And I think we had, Jennifer, you want to speak to the bill? I think we have one more witness to speak to the bill. Come on up.
My name is Jennifer Federa with the Virginia Network of Private Providers, and I've spoken to many of you. We're not opposed to the bills. We're not opposed to the idea of further training for staff, regardless of how it's done. We're not opposed to using the sanctions component of the code, which is already there. If we are going to do new regulations, we would please ask that you insist that the provider community, through its associations, have a seat at the table in discussing that. That's all we're asking. Thank you.
No, thank you. I think that will happen. Great. Any other questions? I think we'll move forward with. What I'm hearing is we can move forward with both. We certainly want to hear from Delegate Siebold on this. And then we can certainly square things up as necessary. So, any other questions? Otherwise, we'll operate by motion.
Second. Oh, I'm sorry.
The motion is to report.
Right. No amendments, though.
I'm sorry. Yes, there were.
There's a line amendment. I apologize. We missed that.
Yeah, I'd like to move the line amendments.
Do you have a motion to move the line amendment?
We already did that? Okay.
We did do that. Okay, we did. Okay, I'm making sure we got that covered.
Second.
We have a motion that's been properly seconded to report HB 1370 as amended, and we'll go on the board. Try again. See that?
Did not go.
Well, it's not seen on our board there. Let's see.
Let me close it.
May try that again. We may try this one again. So destroy that roll and
I'm
try
sorry.
again. That's okay.
Okay, it's going to keep me in the committee, so we'll do it by voice vote. It's going to keep me in the other committee. Sorry.
We had this bill in front of the subcommittee, so it's still showing up on that.
I'm just going to do by voice vote. That's going to take, that will save the.
Okay. We'll do a quick voice, quick roll here.
Let me do it.
Yeah. And if you just can respond to the clerk.
Tran.
Just,
Yes.
Yeah.
Aye.
Hope. Aye. Price. Aye. Hayes. Aye. Rasul. Herring. Aye. Shin. J. Cole.
Aye.
Aye. Aye.
No.
Mr. Chairman, point of order.
Yeah, we don't.
Mr. Chairman.
Do you vote on this?
I vote yes.
Mr. Chairman, is it a wrong list?
She is in this. Oh, that's right. That's it. The ayes have it.
Okay. And that reports, is it 20? And that reports by a vote of 20 to 1. Thank you so much.
Thank you, Mr. Chair.
Delegate Matter, appreciate that. And we'll bring Delegate Siebold out with a bill that's going to sound familiar, but different.
Thank you, Mr. Chair. I'll save some time. I will not go through the specifics of the report like my colleague, Delegate Mehta, did so well. But I do recommend, if you haven't read the report yet, you get your hands on this because, Mr. Chair, it's very powerful but very disturbing, but it should be required reading for all of our General Assembly members. So, Mr. Chair, my bill HB 13.8 just goes a little further, and it directs the Department of Behavioral Health and Developmental Services to impose sanctions for repeated violations by licensed facilities. While Delegate Mehta's Bill 1370 addresses emergency medical drills alone, this bill goes further by ensuring that when providers repeatedly fail to protect the people in their care, there are real and enforceable consequences. We cannot continue to tolerate a system where providers face no escalating response, even when the harm is foreseeable and repeated. This bill is about prevention, making it clear that when the state entrusts providers with the care of vulnerable Virginians, failure to act in an emergency will not be ignored. So I thank you, Mr. Chair, and members of the committee for also hearing this bill.
Delegate Siebold, thank you so much. I really appreciate what you and Delegate Mehta have done here. Any questions for the patron? And this does have a fist, so that we will need to send this up to
Move the report and refer to appropriations.
Second.
We have a motion that's been properly seconded to report HB 1380 and refer that to appropriations, and we'll go on the board.
You're not going to be able to. It's going to have to be a voice.
Okay, we have the same thing. This is
Yeah.
still showing.
I can't go back and forth.
And do you have the updated?
Tran.
Aye.
Hope.
Aye.
Price.
Aye.
Hayes.
Aye.
Rasul. Herring. Aye. Shin. J. Cole.
Aye.
Henson.
Aye.
Gardner. Cole. Info. Cohen.
Aye.
Downey. McGuire.
Aye.
Hodges. Walker. Cherry. Scott.
Well.
Waxman. Griffin.
Aye.
Corat.
Aye.
Okay, I'll fix this one.
And the motion carries. I think there were 19 yeses and 2 noes. Thank you so much. Really appreciate that.
Thank you, Mr. Chair. Appreciate it, and members of the committee.
Great. We've got next up, we're going to have the Health Subcommittee report from Chair Hope. We do have a block of bills which were uncontested in the subcommittee, and that block includes HB 300 from Delegate Hope, HB 756 from Delegate Runyon, HB 1336 from Delegate Fowler, and HB 1353 from Delegate Cohen. And we have no amendments to this, so we can actually vote on that block as presented.
Mr. Chairman, I would move in that block all the substitutes and all the amendments.
You did something, okay. We have a motion that's been properly seconded to move the substitutes and amendments to the block. All in favor say aye.
Aye.
Any opposed? No. Okay, that carries.
Thank you, Mr. Chairman. House Bill 300, patroned by Delegate Hope, establishes that cooperative agreements approved pursuant to the recommendation of Southwest Virginia Health Authority shall expire 10 years after the initial approval of the State Health Commissioner. The bill further directs the Department of Health to transfer all records related to the approval and supervision of the cooperative agreement to the Attorney General within 60 days The bill directs the Virginia Department of Health to repeal the provisions of 12 Vax 5-221 of the Virginia Administrative Code upon the first expiration of the cooperative agreement. The bill reported with a substitute by a vote of 10-0. House Bill 756, patroned by Delegate Runyon, removes the requirement that a copy of the petition to a circuit court to amend the death certificate be served upon the State Register of Vital Records. The provisions of the bill do not apply to petitions filed by the aggrieved applicant after the State Register finds reason to question the validity or sufficiency of the evidence presented to the State Registrar. The bill was recommended with substitute by a vote of 10-0. House Bill 1336, patroned by Delegate Fowler, clarifies the definition of a 3-unit service dog team, that a person who is an adult and who has been trained to handle a service dog can include the parent of such person with a disability. The bill was reported as amended by a vote of 10-0. And finally, in this block, House Bill 1353, patroned by Delegate Cohen, directs the Commissioner of Health to convene a work group of relevant stakeholders to evaluate the feasibility of a statewide maternal health safety initiative. The bill reports the interim report to the work group by November of 2026 and final report by July of 2027. The subcommittee recommended reporting that bill with amendment by a vote of 10-0. That's a block. I move all the bills aforementioned in a block.
Second.
Thank you. Oh, I do see a question from Delegate Griffin.
Thank you, Mr. Chair. Would this be the appropriate time if I want to pull one off the block?
It would.
Okay. Can I pull, was 815 included in that?
No, we did just 300, 756, 1336, 1353.
Can I do like a point of order and you have someone repeat what bills that includes, that block includes? And I apologize for that.
No, I'll just read them right here. I'm sure that missed one. We have HB 300, HB 756, HB 1336, and HB 1353 in the block.
All right, Mr. Chair, can I pull 300 off the block?
That's fine.
Thank you.
I don't think we need to vote on that. We'll just pull that one.
Yeah, I just pulled it out.
Yeah.
So it's 756, 1336, and 1353?
Yes. So we have the block before us of the three bills with substitutes as amended. That's been properly motioned and seconded, and we'll go on the board.
This is just report.
This is a report, yes. And the block reports by a vote of 19-0. I now will then bring us back to HB 300.
Second.
And did that have any amendment? So we have a motion that's been properly seconded to report HB 300 with substitute, and we'll go on the board.
Hang on 1 second. I'm going to get it up.
Okay. Oops. It's
coming.
It's coming. And we'll close the roll on that. HB 300 with substitute reports by a vote of 18-1. Thank you, Chair Hope.
Thank you, Mr. Chairman. We also took subcommittee action. I think the full committee needs to take this action. House Bill 81, patroned by Delegate Price, under Rule 22 to recommend carrying that bill over to 2027.
Second.
So we have a motion that's been properly seconded to carry over HB 81. That's a voice vote. All in favor say aye.
Aye.
Any opposed? That will carry over.
Thank you, Mr. Chairman. House Bill 435, patroned by Delegate LaVere Bowling. This bill would direct the Board of Health to include in its regulations a requirement for every hospital, nursing home, and certified nursing facility licensed by the board to establish a system for identifying patients or residents who may benefit from palliative care and provide information about these and facilitate access to appropriate palliative care services for patients who are residents who are experiencing illness, injuries, or conditions that may substantially affect their quality of life for a short period of time. A bill also directs the Department of Health to establish a palliative care a consumer and professional information and educational program to maximize the effectiveness of palliative care initiatives in the Commonwealth. The subcommittee recommended reporting with substitute, which I move at this time.
Second.
We have a motion that's been properly seconded for a substitute for HB 435. All in favor say aye.
Aye.
Any opposed? No.
With the substitute, Mr. Chairman, we recommended reporting with substitute and referring to appropriations by the vote of 10-0, and I so move.
Second.
We have a motion that's been properly seconded to report with substitute and refer to appropriations HB 435, and we'll go on the board. And by a vote of 18-2, HB 435 will report with substitute and be referred to appropriations. And Chair, I think you have one more bill from you.
Yes, Mr. Chairman.
Yes.
House Bill 1347, Delegate Cohen carried a bill that I can't pronounce the drug, directs the Board of Pharmacy to promulgate regulations that allow for prescribing, dispensing, possessing, and using any FDA-approved formulations of psilocybin following rescheduling of the U.S. Drug Enforcement Administration. The subcommittee recommended reporting by a vote of 9-1, and I so move.
Thank you. We have a question or a comment from Delegate Walker.
Thank you, Mr. Chairman. I had some questions regarding this bill the other day from Delegate Cohen, but after becoming of a clearer understanding or clearer mind, I now support this bill and would move, hope that it would go to the uncontested. So I'm changing my vote to yes. Thank you, Mr. Chairman.
And thank you, Delegate Walker. Any other questions on this one? Otherwise, we have a motion that's been properly seconded to report HB 1347, and we'll go on the board. And HB 1347 reports by a vote of 20-0. Excuse me. Thank you so much, Chairman Hope. And with that, I think we have completed the full committee's business. We are going to do another hot seat swap and go right to health professions. And with that, we are adjourned. Thank you.